what about transplant? So please tell us about transplant for liver cancer.
Yeah, so liver transplant is another surgical procedure that can be considered for early stage liver cancer. So in contrast to surgical resection, liver transplantation involves removal of the entire liver, and then replacing this with a quote unquote new liver that would, once again offer cure from both the liver cancer as well as the underlying cirrhosis. In contrast to resection, liver transplantation is the ideal treatment if one has both liver cancer as well as underlying liver dysfunction. Whether this is complications from the cirrhosis, you had mentioned ascites, encephalopathy previously. If you have any of those complications, or if one has what we call portal hypertension, abnormal blood flow going through the liver that causes an enlarged spleen, or enlarged veins in the body that can also be a sign of liver dysfunction. So if one has an unhealthy liver in the setting of early stage liver cancer, liver transplantation is the best long-term treatment to offer cure. And this, once again, is associated with long-term survival, 5-year survival, well over 70% in most patients. One of the limitations of liver cancer historically has been the availability of organs. So this is typically those new livers are derived from patients who pass away and are willing to donate their liver. We've seen increased use now in the United States as well as globally of living donor liver transplant, where one is able to donate part of their liver to somebody who needs a liver. And both the donor, the person who donates their liver, as well as the recipient, the person who needs the liver, are able to survive and do quite well with partial livers that grows over time. The other thing that we've seen change over time is the eligibility for liver transplantation. Historically, we used to do this only for very early stage tumors within the Milan criteria. So 1 lesion less than 5 centimeters, or 2 to 3 lesions, each less than 3 centimeters, in the absence of vascular invasion or distant spread. But we've now started to realize that even patients with larger cancers that respond to other therapies can be downstaged to be transplantable. And so the number of patients that are eligible for liver transplantation for liver cancer is also increasing over time.